Hi, good afternoon, everyone. Welcome to our Unit 4 discussion. Today we're going to be talking about sutures. There are a lot of sutures. We're going to talk about basically how you're going to learn what each suture is, what it does, the size, how understanding like how it's picked for the surgery and the surgeon because that critical thinking process is very important during the surgery, and the surgeon will depend on you to have that understanding of suture when you start doing your clinicals. Okay, so our assignments for this week include your typical discussion post. Remember, it's due on Wednesday, and then your response to your peer is due Sunday. So you're also going to have a couple other assignments, a couple realize it's. Okay, so just to give you a heads up of your points here. All right, so like I said at the beginning, how are you going to know what suture you need to give the surgeon, right? The surgeon will hold out their hand and basically just say stitch or suture or something like that. How are you going to know what to pass? What if you have 4 or 5 different suture packets on your back table? How are you going to know without asking and maybe risking sounding like you don't know what you're doing, right? So it does take some practice. And that happens a lot. The surgeon will just hold their hand out and expect you to know what they need or want. So that type of anticipation takes some getting used to, some practice, just, a lot of review and repetition will get you there, right? So that's what we're going to do today. We're going to learn the basics, and I would highly recommend this particular subject that you would make note cards for, okay? It's because there's a lot of little important details that we're going to cover that all play a part in picking the right suture and knowing what that suture is used for. So we're going to start with the 4 main categories of suture. We can break it down this way, and suture will fall in one of these 4 categories, and actually 2 of the 4, really, if we're being picky. Because you can say a suture strand, and I tried to include some pictures here, is either monofilament or multifilament. That's kind of the first basic way of dividing them. And this picture here, if you were to take that strand and like make it bigger so you could see it, monofilament is like one single strand of suture. You can feel it, you run your fingers down it, it's very smooth, like fishing line. That's a good example, okay? Multifilament would be if you had a lot of smaller fishing lines weaved or braided together. So sometimes multifilament suture is also called braided suture, and you may see that on your suture packets, braided. And when you run your fingers down it, you can feel the bumps essentially of where it's weaved together. Okay, you could also classify suture as either being absorbable or non-absorbable. Does that strand break down in the body over time or does it not? So you could have a monofilament absorbable suture, or you could have a multifilament absorbable, or mono non-absorbable, multi-non-absorbable. So they can come in a variety of ways. So I tried to give you some examples here under the absorbable part. I have a chart later that shows you more sutures. So this is not inclusive. This does not include all absorbable sutures here, just to give you an example. Okay, so absorbable suture could be what's called chromic gut or plain gut. You can see here by these pictures are also monofilament. So these are a monofilament absorbable type of suture. So we will also discuss, if something is absorbable, what is that absorption rate? So that is also an important factor in picking the right suture. If it absorbs, does it absorb very quickly by the body, or does it take 100, 200 days for it to absorb? So those things matter. And then non-absorbable here are 2 examples. One of them is silk suture and stainless steel, which seems obvious. It's not going to break down in the body. Okay, so we'll talk about those absorption rates again here in a bit. And here's one of those charts I was talking to you about. So this little column right here, it says Ethicon suture at the top. Ethicon is one of the main brands or companies that make suture. Covidian is another super common one. So you may see something that's very similar to Vicryl, it might be this like light purple color, but maybe it's not called Vicryl. Okay, it could be called polysorb if you have Covidian suture. So it's important to learn all the names for these sutures. Now you notice they are color coded here. Your packets of suture are color coded. And in my however many years of being a surge tech, since 2008, these colors have not changed. Not to say that they couldn't, and typically books will tell you not to memorize suture by their color because the company could change them if they decided to. But you'll learn to identify them by their color. It's just easy. And that's why they do it. It's, to help you see what you're doing. So these two I had mentioned at the very beginning were chromic and plain gut suture, were a type of, if you go over a couple columns, oh, here it is, construction, monofilament. And then if you look up the absorption time over here towards the right side, if it has a number of absorption days, so it would mean it's absorbable. Down here at the bottom, NA, these are non-absorbable sutures. So if it were me and I was a student learning suture all over again, I would take the time to maybe pause this and make note cards of each suture. And there's more than this. This is just a good start. But I would make one for every single suture here. Put the name, like Vicryl. Also put the material, because sometimes, especially when you go to take your certification exam, they may ask you this name, polygalactin 910. So Vicryl is its brand name, what you'll most likely hear it as. But sometimes they'll refer to it as polygalactin 910, which is really what it's made of. It's like kind of its chemical composition, so to speak. Now, up here with chromic and plain gut, some of these are naturally occurring. Like this one, chromic and plain, are made from cow or sheep intestine. How they came up with that, I don't know. Why they came up with that, I don't know. So beef serosa, and the serosa is the outermost layer of the intestines, and then submucosa is kind of the middle layer of, they say sheep here, of their intestines. So it is natural, and chromic and plain are monofilament. Okay, if you go over to this coating category, some of them do have a coating on the outside of it. I'm gonna find a good, like Vicryl is often coated. Sometimes these braided ones, like the silk is braided or multi-filament. I mean, it's actually coated in beeswax. It helps it just slide through the tissue better. Sometimes it's actually coated in an antibacterial solution, so that would be better for something prone to infection. This material color, you may not necessarily need to put this on your note card, but it tells you the color of the strand. Sometimes they match the color of the package, like Vicryl is a purple package. Sometimes the strands are violet, but not always. Okay. So this PDS is also violet or clear. Silk is black, so it doesn't always match up. But I just wanted to point that out to you, that not all suture strands are the exact same color. You can sometimes tell by the color as well. You also look at the strength or retention profile column. This is telling you how strong that strand stays after a certain amount of days. It's tensile strength is another name for that. You want a good tensile strength for tissue that takes longer to heal, and we're going to talk about that too. But on your note card, I would also make note of A, whether or not it's absorbable, or B, if it is absorbable, what that rate might be, that absorption rate. Okay, so chromic absorbs in approximately 90 days. I mean, give or take a few days, but 90 gives you a good idea, right? If I'm making note cards, I probably wouldn't necessarily put how it works, like this enzymatic digestion. That's how your tissue is going to break it down if it's absorbable. I probably wouldn't put that on a note card necessarily, but it is kind of interesting to see how the body would break it down. Let's point out a couple others here. So definitely the names. Vicryl is polygalactin 910. Monocryl is also known as polyglycoprone 25. That's a lot to say and spell, I know that, but I would memorize those things. It is, so this one's kind of helpful. Monocryl is monofilament, so kind of goes hand in hand there. It is absorbable. So this chart's actually nice. It puts all of the absorbable towards the top and then all the non-absorbables here towards the bottom after starting with silk. Silk down is all non-absorbable. Okay. So go through these, take some time to memorize their names. You could even maybe put a marker on your 4x4, or not 4x4, your 3x6 note card or something. Color it if you want to try to memorize the colors with it as well to color code it. Okay. Marceline is Dacron. That's another name for that. So these are ethicon names. All right, let's talk about another, we talked about tensile strength. How do we pick the right suture, right? You also have to consider your anatomy. So you have probably taken anatomy at this point or are taking it. It is very important for surg techs to understand anatomy. And I think sometimes surg techs think, oh, I'm not the one doing the surgery. I don't need to know this stuff, right? You really do, because you're a vital member of that OR team. So, the surgeon will often place a lot of trust in you based on your knowledge or your competence. If they don't think or feel that you're competent enough to do that job, they're not going to put a lot of trust in you, and that could really affect patient outcomes. So we don't want to do that. We want to be knowledgeable about what the surgeon is doing, the anatomy, the patient. So understand these tissue types and how they heal, okay? Skin, you've probably all had a cut or an abrasion or something. You kind of have a good idea of basically how well your skin will heal or, create a scab, close back up. Now, some of these others, they're different. Not all tissue heals the same way. And look at some of these, like muscle might take, depending on the type and the pressure being put on that muscle, could take up to 3 months. Some of these are 6 months. Cartilage, for sure, takes a long time to heal. Nerve, and this last one, nerve tissue, can be somewhat debatable, and it depends on the extent of the nerve damage. Some nerves cannot heal. Once they're severed, they're done. Sometimes, depending on the nerve, it could heal. But that's beside the point. Cartilage, for sure, takes a long time to heal. So when you're picking a suture, and you go back to that chart and you're like, I have chromic gut on my table, or let's just go back. Or I have, let's see here. You find one. Or maybe PDS. And I know that cartilage takes maybe up to 3 to 6 months to heal. Would I want to pick chromic that will absorb in 90 days? No, that would be a bad choice. You're going to end up, allowing that patient to have an injury later. And yes, the surgeon would probably stop you before you handed a chromic suture to suture up a joint, but that's not the point. Point is, maybe they didn't catch it. You want to make sure you're competent enough that the surgeon doesn't have to question your ability here. You need to know what sutures are used for what type of tissue. So keep this in mind. Things like ligaments, cartilage, muscle take longer to heal. So you don't want a short-acting absorbable suture for those. You might even want a non-absorbable suture. Okay. So another thing to consider with suture, there's a lot of things that you have to consider. The next one is the size. So we're talking about here the diameter of the strand. You're looking straight at it, how round is that diameter strand? Not how long, but the diameter. So think of this as like a time chart, so to speak. Here, where it says 12-0, this is your smallest side. And then on towards the right side where it says number 5 is your biggest suture. So here where it has the dashes and the zeros, we would say that the small one here is a 12-0 suture, 12-0. We don't say 12-0. We just don't. It takes too long. Okay. So 12-0 suture, 11-0, 10-0, 8-0. I've never seen a 9-0 suture. It may exist, it's just not as common. But these super small ones are for micro surgeries or ophthalmic or eyes. So super, super small. And I've actually read that the 12-0 suture can float in air. It is so light and fine. So you definitely need a microscope and special, very precise needle holders for those types of things. Just for reference, the 7-0 suture here is about the size of a human hair, a normal human hair. Okay, to give you an idea of what we're working with here. So 12-0 would be much smaller than that. Okay, so anything here in this 8-0 to 6-0 category is usually for vascular, like reanastomosing blood vessels. Now, and it would depend on the size of the vessel. If you're getting like towards a bigger vessel, you might want a 6-0. If you're doing much smaller vessels, you might have an 8-0. So to give you an idea. We're working our way up bigger here, so skin or even subcuticular, which is below the skin, maybe the fatty tissue, could be anywhere in this 5-0 to 3-0 range. 4-0 is very common for skin. Now, if I'm going to do suturing this, like if I'm going to suture the skin on maybe the back, that skin's a little bit thicker, or even maybe the soles of the feet. That's thick skin. You would maybe want a 3-0. Now, I probably wouldn't put a 3-0 on the skin on my face. That might leave a big scar. So I'd probably go with a 5-0 there. So there is a big difference between those two, just on that, just two down or up, however you consider it. And then fascia. So if you're not familiar with what fascia is, it's a dense connective tissue. So it's pretty thick, pretty heavy, that surrounds muscle. So you can typically see it when you're closing the abdomen really well. It's white, really dense and heavy. So you need something a little bit bigger. I would say mostly a 0 if we're talking about the abdominal fascia layer. And then number 1. So at this point, now we're just going to say a number 1 suture, 2, 3, 4, 5. And as far as I know, the 5 is the biggest. And you would use these for your really dense tendons, orthopedic repairs. If you had it in a stainless steel suture, you might even use it for like sternal closure if you do a thoracotomy. So that's much bigger here. So memorize this little timeline, so to speak, so you understand the sizing of sutures. And we'll talk about how it looks in the package here in a bit. But to compare the sizes, I want you to see some of these, like just the difference between a 0, like I said before, in this top left here, versus a 2-0. You can see on the package right here, it says 2-0, that's 2-0. So it is thinner, and it makes a big difference in the anatomy if you're suturing something that is dense and high stress or pressure, especially in the abdomen. You know, if you try to suture the fascia in the abdomen with a 2-0, it's going to have a higher risk of breaking, and we don't want that. The incision would come back open, or we call that dehiscence. Right? So then this 0 over here to show you the difference, especially these two prolines, also called polypropylene. Difference between a 0 and a 4-0 suture. There's 2 in this package. This is a double-armed needle. Much thinner on the 4-0. I thought this picture was interesting here at the bottom left. All of these, this strand in the middle is a human hair, so it kind of gives you, you know, just some comparison to how that would look. That 11-0 is super small. Okay. All right, so attached to each suture strand, the material that we were just talking about, is a needle. If there is no needle attached to it, it is called a free tie, or maybe it's in a reel with no needle attached. That can happen. You can have just the suture material without a needle for free ties. Maybe they just need to tie off a vessel, and then they will just cut the strands off. Now, with the needles, there's a couple of terms you need to be familiar with. Okay, we're going to talk about, you know, what the needle shapes mean, etc. You need to know the three main parts to the needle is the tip, the body, which is the majority of it, and the end part where it attaches to the strand, the material itself, is called the swage. I've heard it pronounced swag. I think it's swage though, okay? A swaged needle, which is one of your definitions here. So a controlled release suture is one that it is attached to a needle, but the strand will come apart if you pull it very quickly away from the needle itself. We would call a controlled release a pop-off suture. So there are certain packages that will state their controlled release. So those are super handy if the surgeon needs to, make a couple quick suture passes. They'll pop that needle off very quickly and hand you back the needle driver with the needle still loaded on it while they finish tying off the suture and then snip the strands. A conventional cutting needle. Now we're going to talk a little bit, some of these are related to how, if you were to look at the tip of the needle straight on, they can be shaped differently because they go through the tissue differently. And that's this term, conventional cutting needle. Some needles are cutting, some are blunt, some are a tapered needle. So it means they go through the tissue differently. And different tissue, like we learned before with healing, requires a different type of needle. That way you don't damage more tissue than you really need to, and it's more effective. So the conventional cutting needle is a triangular point with two cutting edges along the inner curvature. I'll show you a better picture of that in a minute. A Keith needle is a straight cutting needle, so the edge of it cuts through tissue, but it is straight. A spatula needle is, again, if you look at the tip, it's really good for eye cases. It's really unique. It's not used very often except for those types of cases where it basically cut the top of the triangle off is what it looks like. Reverse cutting is similar to conventional cutting, except it says the cutting edge is on the outside curvature to prevent tissue cutout. Talked about the swaged here, so that the swage is where it's attached. And then a taper cut is kind of both. It's a taper needle and a cutting needle. One I didn't put on here is blunt, in that it doesn't cut through the tissue at all. Its tip is pretty rounded, and it would only go through tissue that is very friable. If you know what that term means, it's really delicate. So a good example of needing a blunt needle would be used on the liver and spleen, to give you a good example. Now here's that picture I was talking about. To see the different types of needles, like this picture right here, and we'll show you again on the package. Here at the bottom right side, see the triangles, circles? That is if you are looking directly at the end of that needle, straight on. That's what it looks like. It will look like a triangle. Reverse cutting is like an upside down triangle. Taper is, it does have a point, but it comes to, fans out a little bit. And this blunt has no point, sharp point on the end of that needle at all. Okay, they can also come in different, essentially lengths of the needle, called the needle cord length. And the needle radius can be different. So we're talking about it in reference to a circle. You could have just a half circle, so it's not a very long needle, essentially. This big 5/8 curve, we use a lot we make an incision in the near the belly button to put in trocars. The incision's not very wide, but we still want to suture up that fascia. It kind of gets in there really well and makes that curve in a short space. So you'll see that one pretty often. This 3/8 curve is very common as well. Now this straight one, the other name for that straight needle was a Keith needle. Some docs still use that. We used it in ENT with one of my doctors would suture in nasal splints right across the nasal septum with a Keith needle. I also worked with an old Vietnam doc who that's all they had back then. They just made use with it, and he would actually still suture incisions with a straight Keith needle. It's kind of barbaric, but it worked for him. Okay, so it's also important to know some of these suture needle codes. You're going to see these on this packet I'm going to show you here in a minute, because certain needle configurations and suture configurations are specific to certain things. Okay, like for example, that blunt needle will have a code BP, blunt point. Sometimes you'll see cardiovascular pretty often if it has a C code on it. So CB, cardiovascular, FS for skin. So just kind of giving you an idea that ST, straight taper, they mean something, okay? Do I have all these memorized? No. Whenever you start working, you're gonna see some that just come up a lot, and that's just gonna be what you work with, and you'll understand what that means. I do not have these memorized by any means. Okay, so here's the suture packet, and you need to be able to read and understand what you're looking at. So some suture packages may only come with one needle in it. Some may come with two, like I showed you before, 6, 8. It really just depends. But you always want to visually see the needle in the package whenever you're setting up your table and counting with your circulator. Because if you know that this package should only have one needle and you open it up and there are two, you need to account for that. Sometimes the manufacturer messes up and you might have a rogue needle, or you might not have a needle at all. So always need to visually see your suture needles. Okay, super important. Now, a couple other things. Your suture name is usually very big. It's usually the first thing that you see. That's what we're going to call it. SurgiPro or polypropylene is another name, Proline, just depending. So this is Covidian. That chart I showed you at the beginning was Ethicon. So the equivalent to Proline is, in Covidian terms, is SurgiPro. So your facility may use one or the other or both. Sometimes certain surgeons demand certain sutures, so you might have both. Needle material, like what is the actual needle made of? This is a Surgiloy. You don't have to pay too much attention to the reorder number unless that's part of your job. The needle code is one of those things I had told you before. Let's see if P is on here. P, plastic. So this would be often used in plastic cases, like plastic surgeries. You could, and it doesn't exclusively mean that. You could use it somewhere else if you needed to. It shows you exactly what that needle looks like and the shape of the needle. That's a 3/8 curve. Showed you a picture of that. And the triangle means it's that reverse cutting needle. So it tells you it's cutting. Always check your expiration date. That is super important, because if you get a suture that's expired and you try to use it in the patient, it doesn't necessarily mean that that suture isn't sterile, okay? In this case, I would be more concerned with the integrity of the suture strand, because after that expiration date, that strand's integrity cannot be guaranteed. So that tensile strength that we talked about at the beginning, it could break way sooner than it needs to, which is going to leave that wound maybe at risk for dehiscence, breaking apart and not healing. So never use expired suture. Suture color, it tells you the strand color. In this case, this one's blue. The gauge is the size. So that is a 6/0 suture, pretty thin, pretty delicate suture. You would probably need a special needle holder for this, like a Castro Viejo, if you've learned your needle holders. It even tells you the length of the suture strand. So you might have a 6/0 P10 cutting needle, 18 inches. You might have one that's 36 inches. So that is going to change the number here for reordering and making sure you have the right one. So always check these things. It even tells you right here it's monofilament. So that's kind of nice if you just didn't know. It's usually on your package. So to give you an idea of what you're going to see with every single suture package. All right. I know that's a lot of information to cover and to expect you to memorize it. It takes time. Okay, so make sure you're putting in that effort to memorize those types of sutures, especially the ones in that chart. They're common. You're going to see them when you start scrubbing in all the time. Okay, so if you have any questions on any of those, please reach out to me. I do have office hours on Tuesdays. Whoops, I missed my thing here. It's from 1 to 3. Sorry about that. Eastern time, but we can make other arrangements if you need to. All right, so let me know if you need anything. Have a great week.